Hi, everybody. Chelsey Jean here with the amazing Dr. Oz. And Loz is on holidays today. She might just join in a little bit later, but she's on the sunny Gold Coast at the moment having a week off. And, you know, we are a dynamic team of wellness experts, and we're here to boost your energy, help your well-being the three of us come from a little bit different backgrounds, but, you know, we all come together with one goal, and that's to help you with your health. So my name is Chelsey Jean, for those of you just joining in. And if this may be your first time, I am a naturopath and I specialize in lymphatic health. I have a clinic in Brisbane, in Capalaba, and also at Springfield, but you can also find my things all over the web and look into my treatments. And Dr. Oz, if you wanted to introduce yourself too.
Yeah, I'm Dr. Oz from Vitality. I'm a peak performance and integrative clinician. I specialize in chronic pain, chronic inflammation, with the combination of natural supplements and technology. So, and we're based here in Brisbane as well, in Springfield.
In Springfield, yeah, and that's how we all got together in that little group, and over in Springfield. And it's just amazing when you bring, like, one person can come in and say, hey, you know, I do this, and then the community sort of builds, that energy sort of builds. And when you find each other, and that's the thing that I love about health and joining together. And one thing that joins together that we don't like, Oz, is when the tissues all join together and fat comes up and presses it all. And, you know, sometimes our skin can look like a bit of a mess, and it's called cellulite. So that's the topic of today, and love it. I don't think anyone loves it, hate it, live with it. You know, it's a thing now that mainly is about the look. People like look at their skin. We know that it's not going to kill us, right? We know that it's not going to kill us, but you don't like the look of it. And it's a sign that things underneath aren't happy and healthy. So if you can please run through for us, we've got some questions we've got your questions, everybody, about cellulite. So if you could run through, Oz, you've told me some amazing descriptions, and if you could just share with everyone about that.
So look, so I'm going to give a definition that you don't find in books, but before I get to the definition, I have to get into the context of that definition. So cellulite has 4 components. And the first thing I want people to understand about cellulite is we have to get rid of that idea that cellulite is a cosmetic problem. Yes, the appearance doesn't look nice, but as you just say, cellulite is the consequence of something else happening inside of your body. It's kind of a call to action to do something about your health. So it has 4 components. And nowadays, you can see cellulite, not just like before, we used to see cellulite maybe on your 30s or 40s. Now we can see cellulite, and I have seen cellulite here on my clinic on girls like 13, 14 years old, because these 4 components start at that age. The 4 components that I'm talking about is number 1, inflammation. Number 2 is toxicity. Number 3 is fibrotic tissue, and the 4th component is damage. So how this works is that we first start with inflammation in the body. Cells, the fatty cells, start getting inflamed. They get more fat. They get inflammation. That inflammation will cause toxicity by affecting 2 different systems. One is the lymphatic system, and the other one is the circulatory system. Once these 2 systems are affected, they're leaking of toxins, leaking of heavy metals, and things that we don't want outside of the veins or outside of the lymphatic system. And they start creating fibrotic tissue in different areas. In this case, would be the elastic fibers that connect the muscle to the skin, and will start creating some fibrotic tissue surrounding the fatty cells. And that's what makes this really difficult to treat, because one of the biggest problems that most clinicians or most beauty therapists have is that the definition is not the right way, because they define cellulite as fat storage, excess of fat, and they want to treat cellulite by reducing fat. Now, this fibrotic tissue that is surrounding the fatty cells works like a shield, protecting you. Like when we use like equipment like cavitation or fat freezing, won't allow those techniques to actually penetrate, so the fat won't dissolve. So what we have to do is to break that fibrotic tissue first, because otherwise it won't happen. We have to improve the lymphatic system, we have to improve circulation, and we have to reduce inflammation. So just treating fat, just putting you on a fat reduction diet, on a weight loss diet, is not going to fix the problem. Having liposuction is not going to fix the problem. Actually, sometimes make it even worse. And now, having said this context about all these 4 components, my definition of cellulite is like cellulite is a chronic inflammatory condition where the lymphatic and the circulatory systems are compromised, causing an excessive production of fibrotic tissue that will damage the elastic fibers that connect the skin to the muscle, and will damage also the thickness of the skin in the different areas of the body. So that's my definition.
Is it sort of like a scar tissue around the outside?
So fibrotic tissue is scar tissue, it's hard tissue. So it's really thick, it's difficult to break. It's like if you have a rubber band and you coat it with a little bit of cement. So that elastic band is not going to be elastic anymore. So you have to break that cement, that concrete. Yeah. So that's fibrotic tissue.
Yeah. And we're seeing it as younger and younger and younger. And so hereditary, is it genes? Like, is there anything like that involved in this?
Look, every time we don't know about the real cause of something, we want to blame our genes. And look, yes, you could, but to me, it's more about, again, the first stage or the first component is inflammation. And the inflammation usually happens because of our diet, because of the lack of some nutrients in the body, because of stress. So there are many other things happening around before your genes. Like I've seen girls 13, 14 years old, their mom doesn't have any cellulite, and they have it. So you want to call it genetic? You could. At the end of the day, almost everything could be called that is genetic. But to me, it's more acquired by our habits and by things happening. Like when your nutrition, your body is not absorbing all the nutrients that you need, and you start creating some inflammation in your body. Systems like the lymphatic system get affected straight away, so you don't release toxins. And if you see the previous definition or the normal definition that you find on internet is accumulation of toxins, well, that's your lymphatic system. Yeah, most of patients with cellulite also have, if not varicose veins, at least spider veins or reticular veins showing on their legs. And the third component that is also affected that I didn't mention is the endocrine, which is the hormones. Yes, and it's when the estrogens play a role in this condition.
Yeah. So, and we have to make it clear that you don't have to be fat to have cellulite. You can be skinny and have cellulite as well. Yes. Yes.
And actually, I want to talk about my personal trainer when I was in Sydney. She has, I think, no more than 20% of body fat, which is like you couldn't see any fat on her, and her cellulite was really, really bad. So it's not exclusive. That's why I say that definition of fat is not the right definition. Like fat is a component. It's actually the less of your problems is the fat.
Yes.
Because the biggest problem is the fibrotic tissue. Yes. The other biggest problem that you have is your lymphatic system, is your circulatory system. So there are many things before the fat. The fat is just something that is making it more evident. You can reduce fat, but the cellulite will still be there. Yeah. That makes it not a fat problem.
So when it comes to hormones, there are different body shapes as well that I see in women. And I'm just going to run quickly through what I see and what I call them. So you see the women who are more, we call it the pear body shape. And that is like more estrogen, those childbearing hips. And what I find with those women is that their liver can't get rid of the excess estrogens as it should. And in my own case, I've got, you know, the brown spots on my face that show too much estrogen levels and liver. My liver gets into a little bit of trouble. And when I did my my hormone test, my Dutch test, it came back and it showed up that I have a really high level of fake estrogens, like the plastic estrogen, the estrogen mimicking xenoestrogens that are in my system. And that's my body shape. So I would hold, you know, fat on my booty and on my legs. So that's the estrogen body shape. And then you've got the thyroid body shape. So the thyroid body shape is the straight up and down, no boobs, no bum, pretty much people who are really stressed out, normally smoking, or just out and about and like full on people. So they normally have like more of a heart disease problem. And then you've got the android body shape, which is more of the testosterone woman that has got little chicken legs, and then their body is more like a square on top. So they've got more of the testosterone features of the heavier chest area. And then you've got the lymphatic body shape. And unfortunately, the lymphatic body shape is why I explain it like you can walk past a KFC and just smell it and then tend to put on weight. It's really hard for anybody with the lymphatic body type. They put weight on everywhere to reduce the weight on their body. So hormones certainly play a big part in how our body shape is. But saying that, you can be born one shape and sort of morph into more of another body shape, because now I'm getting more top heavier, and I've never really had a belly before, and now I'm getting a belly. So as you age, as women age, we do change our body shape. So one of the questions we had online was, can you get rid of cellulite after 50? So does menopause have any changes? Is it just going to be the same treatment no matter what? Is probably what I'm getting to, Oz. What do you reckon?
Look, one thing I answer to all my patients with any topic, when they ask me if something can be cured, my answer is always, I don't know. Why is that? Because it depends on many, many factors. Now, cellulite is something that if you have it, you will have it all your life. Can be cured 100%? No, because as I mentioned, once you have cellulite and once you have fibrotic tissue on the elastic fibers are damaged. It's like chronic disease. Once you get a fibrotic liver, it's going to be fibrotic all your life. Doesn't matter what you do. What you can do is improve the condition and regenerate part of the structure, but not fix it completely. So can be cured 100%? No. I always tell patients that with cellulite, I can, if you want me to promise something, I can promise up to 80% of improvement, which is great, because we're talking that cellulite has four stages. And if you're in stage 4, to bring you down to stage 2 is a huge difference. If you're in stage 3 and bring you down to stage 1, that's basically not even any appearance of cellulite in there. So at any age, cellulite can be treated, yes. What make it, to me, it's actually more difficult to treat it on young people than actually on older people. The reason why is because of the hormones. In young people, if you have already cellulite, that means that your hormones are really affected in some way. Yeah. As with older people, it's more maybe the lymphatic system, which is something that you can manage with drainage and those things. So I would say that it's more difficult, more complicated in young people, because if at that age you already have that problem, yeah, that means that you already have some damage. That means that the room for getting worse is actually huge.
Yes.
Yeah. So, but treatments are available. Like there are many treatments that can be done. Again, it depends what type of pathway you want to go. In my case, I like to do it with machines. I use all sorts of machines like radio frequency, muscle stimulation. My favorite one, like the one that I that I would say is the gold standard for cellulite is the combination of radiofrequency with microneedling. That's to me the best one. I always recommend that one as the first part of the treatment, and then combine that with radiofrequency or with muscle stimulation, depending on what they need, or with lymphatic drainage, depending. If I can see that it's a lot of swelling, that it's a lot of fluid retention, then I will go for lymphatic. But all the time with most of the patients, radiofrequency and microneedling. The reason why is because radiofrequency will break the fibrotic tissue, and microneedling will promote collagen. So to fix that elastic fiber that has been damaged. So that's to me the gold standard for cellulite.
Okay, so the other thing that I noticed with cellulite when doing treatments with, because we use, as you know, we use the gloves and my lymphatic cream, and like at home and in the clinic. One thing that I do notice on myself, so I know that we don't do everything at once. So some people might be going, okay, well, I'm working on at the moment, like I'm working with you at the moment, and I'm working on getting the inflammation in my body down, you know, first. So that pretty much looking at moving my body and getting my diet, you know, eating more frequently and doing the things that we're working on. So that's sort of my priority at the moment. But then my priority is going to become summer's coming, and it's like, okay, bikinis are coming out, clothes are coming off. Then my priority is going to move to the texture of my skin and the look, you know, in bikinis. What does happen, what I see on myself and what I see in my clients, is that the cellulite, even if it's like at a 4 or a 3, when it is like the really hard cellulite, compact cellulite, it is going to look, now the word I have for this is globular. It is going to change from that harder look to a more bumpy look, right? Do you notice that as well? So there's stages of healing that can look worse before it gets better. Yeah,
and that for example happened more when it's compact cellulite. That's the one that comes on the side of the hips, and that's hard cellulite. That means that it's more fibrotic tissue. So by breaking the fibrotic tissue, the cells start being more like, we have to understand the fatty cell, the normal behavior of a fatty cell is to push out. That's why when we have a little bit of fat on our tummy and we put some really tight pants, the fat comes out, like we look like a burger, right? So that's the normal behavior of the fat. So the moment you break the fibrotic tissue, the fat wants to come out, and the fat is not hard. The fat is soft. So that's what happens when you break that fibrotic tissue. The fat starts pushing out, and then it's when you see that kind of more bubbling kind of appearance, which is great. Like you want that type of cellulite. It's easier to treat than the hard one. The hard one is way too complicated.
Yeah, and it's hard when you are working really, like you're doing all of these treatments on your body and it starts to look worse. And like you get the phone call, I let clients know that it is going to get worse, and that is a sign that we are healing the skin, and then that it's getting better. So yeah, thank you for that. But it is a little bit, you know, it can take a long period of time. It's not something that's going to just happen overnight. There are going to be stages of healing that you're going to go through, that people are going to see. But the other benefits, like in that you're doing, and if someone's going to come to me and say, oh, I've got a bit of cellulite here and I've got a bit of cellulite there, and like, I love that, because I know that helping them clear their cellulite is also going to improve their lymphatic drainage, improve their immune system. So, you know, help with detoxification and all of the benefits of lymph. So to me, if whatever the reason it is for someone to want to help their appearance, and, you know, I'm going to see the lymphatic benefit with that. Yeah.
Yeah, and I think one thing to add here is what we talked about last week, in terms of it's not just one thing, it's the sum of many things, but it's going to give you results. And we cannot live apart talking about diet, exercise, hydrating. So all the things that we talked about last week, all the things are actually, to me, when a patient comes with me, I say, look, 60% of the treatment is your diet, your exercise, your fluids, and 20% of the treatment are the machines, 20% of the treatment are supplements. So it's not just the machine, because that's the thing that most people, like when they come here, they think that just by staying on the machine, they're going to get results. Then no. They're going to help us to speed the process, to give us better results. But if you just do the machines without getting into a healthy diet, and I'm not talking about a weight loss diet, I'm talking an anti-inflammatory diet, which is really different, and you will lose weight with that one anyway, if you need it. But if not, it's going to reduce a lot of inflammation in your body. It's going to help your lymphatic system. It's going to help any other system in your body, your organs, your vital organs and the things. It's going to help you to sleep better. It's going to help you to have a much better mood. So it's a whole package. It's not just treating one thing at a time. And I think that's what we want to do here. We want people to start understanding that when we treat one thing, we don't treat that one thing. We're treating the whole package. I don't see 2 legs of cellulite coming to my office telling me, can you get rid of cellulite? No, those legs come as part of someone, and that someone is suffering. Because if they have the courage to come all the way here to say, I need to get rid of this, is because it's bothering them in some way. Some people say, no, it's not bothering me that much. Then why are you here? Because you want to get rid of that. You want to look better. And by looking better, you're going to feel better. Yeah. So it's taking into consideration that many other things, not just doing the lymphatic drainage, not just doing the machines, not just doing supplements. It's the whole package. It's the whole thing that has to be treated.
Yeah, same with me. It doesn't matter what it takes to get somebody through the door. They want to improve whatever area that they want to improve. I know that everything that we do is going to help holistically, is going to help maybe the things that they don't want to talk about yet. So they come in with one thing, but it could be something else behind the scenes, and everything that we do is going to help with those things. And you same as me, your clinic, my clinic creates this beautiful, safe, healthy atmosphere that's really comfortable for people to be able to express themselves. And some people might think, well, here's Nancy down the road who's suffering with cancer, somebody else is suffering with heart or whatever, and all I've got to worry about is this little pocket of cellulite. Well, cellulite is a chronic condition, as well. No, it's not going to kill you, right? But it is a chronic condition, and it's whatever is troubling you, talk about it, do something about it. We can do something about it.
Yeah, and that's why I started saying, the first thing that we have to get rid of our head is that it's a cosmetic thing, because it's not cosmetic. Yeah, it's not like putting Botox, which at the end of the day is also a thing, right? But it's a condition. It has a background, and if you don't do anything, it's just going to get worse. Yeah, like there's nothing you can do to stop it by just doing the same thing that you have been doing so far. Yeah, it's not going to stop it. If it's bothering you today, it's going to be bothering you in 5 years, and it's going to be bothering you even more in 5 years, because it's going to just keep going in the same direction, or even faster. I don't know. It depends on many things that you're doing. It depends on your age, it depends on your hormones, it depends on many things. So if it's bothering you today, do something today.
Yeah. So let's recap. I know that each week we talk through similar things, but let's recap the things that we can do. So far we've spoken about anti-inflammatory diet. Just give us a quick example of an anti-inflammatory diet, Oz, like from breakfast to dinner.
Okay. It's very easy. Look, it's eating as much salads as you can do during the day. So if you have a plate, you divide that plate in 3. 2 parts is going to be your salad, going to be your greens, like really dark green, leafy things, or could be cooked vegetables, something like that. And then 1 portion is your protein. Your protein has to be the size of your hand, the thickness of your hand. That's your protein. Make sure that you have protein on each meal so you keep yourself, full. And then the vegetables and other things are going to be the fiber for your bowel to reduce things like insulin resistance, glycemic index, that maybe we're going to talk about this on a different.
Yes, we can talk about that next week.
Into that too much, otherwise it's another 3 hours talking about that.
Mhm.
But yes, that's basically it. So as I just your medicine has to be a bowl of salad.
Yeah.
Take it 3 times a day.
Yeah. So we have to make sure that we have fat, we have protein, and then we have the carbohydrates. So we've got to remember that bread and cereal is carbohydrates, sugar, carbohydrates, fruit and vegetables, mainly carbohydrates. Okay. So if you're going to choose carbohydrates, you have to get rid of the cereals, the breads, everything that the food pyramid says to have the most of, let's not have that. So having fat, good quality fat, having your protein, and then having your carbohydrates. Now, I'm not great at lots of salad and lots of vegetables, so I make sure that I have a juice. And so juicing, I will pop in some spinach, I will pop in my celery, I'll use say half an apple and some blueberries with coconut water. So and then I can have that with some, this morning it was a lamb chop and avocado. So I'm getting my protein, I'm getting my fat, and then I'm getting my veggies in and fiber in with my juice. So there's lots of different ways of getting that in. Is that okay?
Yeah, that's good.
Yeah. And then collagen wise, bone broths, that type of thing, boiling the meat and getting some good collagen out of bone broths. Now it's winter. It's a really good way to make really good bone brothy veggie soups as well. Lots of veggies, and get the kids involved, get everyone involved, put every veggie into there and then just put it in the blender. No one's going to know. Yeah. Okay. So diet, drinking water, of course, moving your body. And then when it comes to what you can do at home with using my gloves. So we've got the spiky side on the one side, we've got the magnets on the other. But I just wanted to run through my lymphatic cream because castor oil has been coming up a lot in my TikTok feed lately, and all of the benefits of castor oil. And so castor oil is really good at drawing and helping with fibroids and a lot of hormonal issues. So it helps flush out toxins that can accumulate in fat cells. You can make a castor oil pack. You can get some castor oil's cheap, and putting castor oil on maybe even like a woman's sanitary pad, and then putting that on different areas, fibrotic areas of your body, and putting a heat pack on top. So using castor oil packs, lots of people talking about castor oil packs at the moment, and I'm reading about lots of different responses. I don't know if you've tried it, Oz. I'm reading a lot of great things about castor oil. It's the main ingredient in my cream as well. So lots of different ingredients in here: bladderwrack, goji-kola, frankincense, horse chestnut, white cypress oil, to use on your body to help with cellulite. Now with your gloves, if you are going to be using them for cellulite, get a little bit harder. Make the skin red. Bring that blood to the surface of the skin and create that circulation. If you want to make a change, you are going to have to go a little bit harder with your gloves, following the lymphatic sequence as well. All right, so I can't see any comments on Facebook. I know without Loz here, us two are a little bit technically disadvantaged, Oz. I don't know if you can see no comments. Okay, that's fine. So if you are watching this on replay, ladies, please type your comments in below and we will get back to them. Please also type in the things that you've enjoyed listening to, what you've learnt today, and also maybe type in some things that you are going to do now, because we love seeing people take action. And that's why we're turning up here each week, encouraging you and motivating you to make some changes and to take action in your life. So next week, I'm not sure whether I'll be here or not because I'll be away at Fraser Island. So Oz, you might have to take the reins.
No, loss is back.
Yeah. It's, but we're jumping in and giving it a go, right?
Too much responsibility. No.
Not my responsibility. He's like, I'm out of this. But thank you so much, Oz. I've really enjoyed my time, like in the months of knowing you and all of the stories that you tell. I've learned so much in learning about my body and also learning lots of information for, you know, for my clients as well. And that's what, you know, we love. It's all about sharing. Hey,
It is. Yeah, I learned something new with the castor oil. So.
Yeah, we learn something new each day. All right, so signing off, everybody. Once again, comments, pop them into Facebook, and we're going to be sharing this on all of our different socials as well.
Yeah.
Okay, thank you, everybody.
Bye.
Bye.